It is with a heavy heart that I come to ask for support today. This has probably been one of the most difficult weeks of my life, in that my 13-year-old boy had a serious suicide attempt. And it is an interesting perspective that I come from, in that I work in mental health industry. I work for a nonprofit organization that provides mindfulness and cognitive practices for high trauma communities. And it was a humbling experience that the only option that they were giving us for my son to have inpatient care was a mental health facility that I run a program at. So, coming to terms with that, although I am a person that is part of an organization that provides programs for adolescents and trauma, I can't necessarily be that person to be able to give that care for my own kid, because I'm mom. And I'm okay with that. What I'm not okay with is that there is little to no support for families in the Thornton area. This is a big problem. And we've been trying to get better resources and more therapy options for actually both of my kids are needing some support right now. And through our insurance, and not to fault Kaiser Insurance, because they are a nonprofit organization, and I think they struggle with having the means and the financial resources to do what's needed to provide for families. I know that they were looking at doing something on Highway 7, and I think because of financial reasons we're having to back out of that. And it's a real challenge for individuals that are having to find sources through their insurance. But even if you were willing to scrape together the funds to try to pay for it out of pocket, there's very little resources. And so, that's a huge problem. And I came today with understanding that the first step to sustainable change is awareness. And I'm so grateful that you guys are putting together these committees so that we can come together. I'm truly grateful that Dr. Rosen went before me, because of all the things, and what I am seeing as being a person that works in this industry, is that he just hit the nail on the head of the things that need to happen. The access right now, this is a big issue for us. Driving an hour and a half to get to a counselor that's relatable to my kid is not realistic for a family. And and then the engagement, having access to individuals that are relatable to adolescents. If you're going to give choices that kids can't relate to, you're never going to get kids to engage in a program that works for them. And and understanding the outcomes of what is it that are working. Like all those things that he hit the nail on the head for is really important. And understanding how that access needs to happen quickly when kids are in crisis. They actually legally released us from the hospital with an appointment that was 2 weeks out. That's actually not even supposed to be legal, because my child needed a follow-up with a psychiatrist within a week of being discharged. We were able to get that changed, but it's just so overwhelmed and under-resourced and undersourced. So that's, there needs to be more providers. How do we change that? How do we make this a profession for personnel that feel supported in going into this industry? Right now, it's not worth it. The amount of work and time for what you get paid in this industry, it's a burnout kind of job and not financially supported. We have to change that, where there are more providers out there for individuals to be able to have care. And and then adjusting to the treatment. My child was put into a facility and needed to be cared for and watched for where he was in his own level of needing care, but the kids that he was with were individuals that came from very serious traumas, and most of that was a lot of group therapy, and my son was subjected to secondary trauma through these really hard cases of, kids that just were in there that committed double homicide because of the trauma where they came from, or severe cases of molestation and a lot of sexual abuse. But hearing those cases were traumatic for him, and I don't think helpful for where he was and trying to have self-care, when one of the issues that he's going through is that he's just a really sensitive kid, taking it in all the time. And then here he is getting all this secondary trauma in these group sessions with kids. I think there needs to be, where are these individuals at, and what are the placements for what is the best treatment, instead of just like, okay, this kid's at risk, throw him in a pile of kids in the hospital because that's all they have. And there was a waiting list. We were lucky to get in. They were cleaning out the lockers as fast as they could to get more kids in when we were leaving. And it's sad and it's wrong, and this has to change. We're going to see an epidemic of these kids committing suicide if we do not change this. These kids, and I recognize this is not a fault of my own as a parent, and even a parent that's trained in trauma. It's not my kid's fault that he's having a hard time managing this. He needs the resources to understand how to help him and get him the help that he needs. This has to change. And it has to change for there needs to be more support for parents. Parents are calling me saying, I'm scared as hell. It's going to be my kid next, and I don't know how to help my kid. And I don't know how to help myself. I am so strung out. I am stressed out. Parents don't know how to have self-care to then help their own kids. This is also another place that needs to be looked at. So I see all these steps of things that need to be addressed as you're moving forward. Because if we don't change these things, this isn't going to change. It will get worse. These kids are so overloaded today with all the things that are going on in society and social media, things that we didn't grow up with. It's literally taxing their neurodynamics of what they are able to take on in brain and body. And then they're feeling like failures that they can't manage this on their own. This has to change. Society's not going to change, so we have to give them the skills to be able to be more resilient, to handle the physicalness that's coming at them, where they're literally not able to take it all in and manage it. So those are my issues, and I thank you for listening to this today, and appreciate the support for all that you're doing. I'm so truly grateful that our governor and all of the individuals here today are working on this issue.
Thank you for sharing your experience.
Thank you.
I hope your son gets better.
We're working hard to make sure that the support gets in place to help him to get better. And I will work very hard to do that.
Well, like you said, take care of yourself too, especially.
Yes, absolutely. I'm working to get self-care for my whole family.
Thank you.